Good afternoon, everyone. Thank you for joining this session today. My name is Lynn Abu Sulaiman. I lead YouTube Health Strategy and Operations for the EMEA region, and I am delighted to be a host for today's panel, and we'll be conducting a discussion on how we may make public health truly public. Let me kick this off with a brief introduction of the subject for this panel. So, as we all aware, public health systems across the world face many challenges, and many of these were tackled during the summit in the last couple of days. And those include, the design and the delivery of equitable services, improving health literacy at scale, as well as limiting the spread and exposure of harmful misinformation. So one common theme that ties these issues together is the theme of information. And in fact, when we examine the impact of information from a broader lens, it's increasingly clear, specifically and particularly since the COVID-19 pandemic, that information is a determinant of health. So we also know that there is an ever-increasing proportion of the world in both high and low-income markets that turn to the internet to solve many of their health issues, even before seeking formal advice from healthcare professionals. So, for today, then, the questions that I'd like to ask the panelists are, on the one hand, how can we improve health literacy in populations in order to provide the foundation on which citizens are enabled to play an active role in improving their own health and the health of their community? Second, how can we ensure health equity and specifically equitable access to health information across countries, communities, and especially in underrepresented and marginalized societies? And thirdly, how can we ensure the prevention, the detection, and the elimination of health misinformation, especially in the digital world? So to discuss these topics in greater depth, joining me today are health experts from across the field. We've got Mr. Andy Patterson, Team Lead of Digital Channels at the WHO. Mr. Elhaj Assi, Chair of the Kofi Annan Foundation and Co-Chair of the World Health Summit Council. Catherine McCarthy, Chief Executive at Medical Aid Films. Dr. Julia Fischer, doctor, journalist and television presenter at ARD Gesund in Germany. And last but not least, Götz Gottschalk, Head of YouTube Health in Germany. So welcome to all of you, and thank you for joining me in this panel today. So we'll start with a quick presentation from each of you, with an overview of each of your organizations and what you do in terms of raising high-quality health information, and then we'll move on to Q&A. Okay. I'll leave the floor to you, Andy.
Perfect. Good afternoon, ladies and gentlemen. Still getting used to live presentations after 3 years of Zoom meetings, so if you could please, in your mind, apply a beauty filter, that would make me feel a little bit more comfortable. We've all been there, we all know about this. So my name's Andy Patterson. I run a team called Digital Channels at the World Health Organization, and my job is to get more health messages to more people through more channels so that they can make better health decisions and ultimately live healthier lives. We are not interested in dragging you into our social media channels. That's a different team. What we're trying to do is elevate WHO content, guidance, and recommendations into your digital journeys. On the average mobile phone, you have 30 apps. You use 5 a day. That's the industry standard. Whatever those 5 are on your phone, I would like to be there, giving you good health messages to keep you healthy. We do this in 3 pillars of our work. Our first pillar is to raise good content, whether it's WHO, our partners throughout the UN World or UN agencies, NGOs, trusted partners, and of course the ministries of health of countries, where we try and support them with their local and national health initiatives. The second pillar of our work is fighting misinformation, whether it's an individual person who's spreading misinformation, an individual post, an individual topic, or a platform itself. Our job is to try to help debunk the misinformation that's out there and to get some of it down. We're really good at getting some of it down on some platforms, but the best and the ideal solution would be to inoculate the internet like a vaccine against misinformation. And that's what we need to do. We need to get very good at stopping it going up rather than excellent at bringing it down. The third pillar of our work is working to find out user insights, where our populations that we want to reach are, what are their behaviors, and also exploring new tools. So my team deals with a lot of AI work and all the buzzwords, the chatbots and things like that you've seen over the last few years. Before I jump into this specific project, I'll just very briefly tell you a little bit about our work with YouTube. We've done a lot of work on the policy side. This is fighting misinformation. It's very boring, not very sexy, but it's extremely impactful. We sit down with their policy, safety and security teams to help them make their policies more robust from a health point of view. We've had some pretty cool collaborations over the last few years, from cartoons to Dr. Mike, who's the most followed physician on YouTube. And we continue to work with them to put out public service announcements, especially at country level, to support immediate and impactful action that's necessary at country level. I'm going to tell you a bit about FIDES. FIDES is a project that we started, but before I jump into it, we're going to play a small video shortly. I just want to take you back to March 2020, when, if you can all go back in time and think about those days where we were going into lockdowns across Europe, the future was looking very bleak. We were realizing we probably had to cancel holidays, tournaments were being stopped, sports events were being stopped. It was a very dark time. I was sitting alone at midnight after, consuming tons of content and misinformation about COVID. And one of my favorite creators came and said, "This is my last post, I'm done, I can't be bothered anymore, I'm trying to help you all, and all I get is abuse, all I get is hassle, so I'm done, goodbye, good night," and he switched off. And I was like, oh my God, this is terrible, what can WHO do? And out of that one moment on a Thursday evening is where FIDES was born. We decided then and there, we should be able to, as WHO, bring some of these creators together to know that they're not alone, if nothing else, and from there it snowballed. I'm going to play a short video now.
Wait, have you ever noticed the overwhelming amount of health content on the internet?
Well, not all of it is good.
Vaccines turn you into a sea turtle.
That's why the World Health Organization has established a network of health influencers.
Our mission?
To spread reliable, science-based content globally.
The FIDES initiative is looking for healthcare professionals and data scientists
to elevate the WHO's science-based health messages using their personal social media channels.
Like mine.
Who do you call when you are at your lowest?
More and more people are using social media to get advice on their health.
So, it's more important than ever to cut through the noise and make viewers as well informed as possible.
We aim to do that through two ways.
First, to spread accurate science-based health messages swiftly among our network. We can do this through content creation and sharing, giving our message a collective impact.
Second, to fight misinformation and stay one step ahead of the latest health rumors.
FIDES isn't just a network, it's a safe haven for its members,
offering crucial support and guidance.
Here you're not just an influencer, you are a trusted voice.
Our community already reaches more than 50 million people.
But we want our network all over the world.
If you want to be part of this transformative journey,
simply search WHO FIDES online.
Together, we are shaping a healthier, more informed world.
And you can be part of the change.
Excellent. That's the first time I've shown this video. I'm quite pleased with it, actually. It gives you a quick summary of what it is, also done by some of the creators, which you will find on the various platforms who are part of this community. So what is FIDES? FIDES is the the Roman goddess of truth. Later, she was a Greek goddess, and I always make this mistake, so apologies for that. And it's where we get the word bona fide from. And so we thought this would be a nice and elegant name for the community of practice that we've put together. As it said in the video, the purpose is to raise good content and to fight misinformation. And we do this as a community. The idea is that we try to move together as a grassroots movement so that we're flooding social media, digital media platforms with the same type of content at the same time. The public health sector is extremely fragmented when it comes to messaging and communications. The anti-vaxxers are extremely well-versed and well-organized, but much smaller. They have a bigger impact. We need to get some of this organization doing this part of our role here. These people are not ambassadors for WHO. We never pay them. We just give them information. At the moment, we have over 100 members. They have a reach on one platform alone of 50 million followers. We have 400 people in the wings hoping to join the community since we started going out and telling people about the community, even though the community has been going for nearly 2-3 years now. We are now expanding, as they said in the video, country level, language level, beyond. What do? We provide health content. Every couple of weeks, we send them messages. We say, this is what's top of mind at WHO. If it resonates with you, if it resonates with your audience, please go ahead and create content. The idea is that we make their lives easier. We give them the basic information, the talking points, and the source of that information, whether it's a white paper or a report or a publication, so that they can go on and do their own research. We never vet the content. These are healthcare professionals. They know what they're doing. They're extremely competent. They have become trusted voices within their own communities, whether they're very small following, but very trusted, or huge following, like Dr. Mike, who's a member of the community. We have social management tools to allow them from a company called Hootsuite that allows them to manage their social media presence across the platforms and get some really good metrics on what works and what doesn't. We give them team support, emotional support, just to say we're here sometimes. In a couple of occasions, we've actually found legal advice to help them, and in one occasion actually helped them contact the police because they were getting actually physically bullied in the real world, which is much scarier than being on social media. We try and get opportunities either with the tech industry to help them develop their competencies on digital competencies, digital literacy. We work a lot with YouTube and companies like that to help build the basics so that they can become better at what they do. And we also teach them about some of the basic things with regards to communications. And now we're building courses with universities to help them deal with spotting misinformation online or talking to their patients about misinformation that they've seen online. So we have a whole program of work in this space. We're obviously looking for people to join the community, healthcare professionals, data scientists, any scientists who got some credibility. You don't have to be on social media. It helps if you are already, but we have two programs. One is once you're in to help you get better, and other people to help you onboard. The onboarding is a bit slower because we have to start from scratch with multiple people. It's quite complicated. But please have a look at the website and find out a little bit more about this content. I'll leave you with a few examples of the work that we've done. A couple of weeks ago, we had World Mental Health Day. We have dozens of creators creating content before, during, and after that event. Also, Suicide Prevention Week. This was a big one that we had recently. These ones are from the World No Tobacco Day last year. What we want to do is expand the community. We'd like to, as we said, we don't pay any of these creators, but we would like to create a creators fund where an external body would help them with some fundraising and get some money for them. We give success snapshots when people publish books or qualify for something else in the community. We help us build a community. We have a recognition system now. People can put it on their CVs as part of what they do for the community, and we will help them with letters of reference. We have this digital literacy training that I told you about a minute ago about spotting misinformation, and we are building a virtual community of practice so that they can talk to each other, because we don't want to be seen as the experts. We just want to be the convener of the experts, which are actually the healthcare professionals who are online. Before I finish, I'll just mention one last thing about our work with YouTube. We've created a guideline of, for want of a better word, some principles on identifying credible sources of health information. We've worked hand in hand with the NAM in the US and YouTube to get this content out. And so with that, because I know hopefully Gigi is going to talk about something a bit more about this in depth, I'm going to hand the floor back to Lynn. Thank you so much for your attention.
Thanks, Andy. Very good transition. Gertz, would you like to come up for your bit? Here we go.
Mental note, never let the native speaker start the panel. How am I going to follow up with this? So I'm Gigi, because my real name is real hard to say in a lot of languages. I'm the head of health for YouTube in Germany, and picking up where Andy left it off, I think one thing that is maybe familiar but not really top of mind is that everybody probably knows that Google is the biggest search engine on the planet, but YouTube is the second biggest by number. And we have a tremendous amount of people coming to the platform. It's 2 billion logged in viewers monthly globally. And to jump to a number that is probably most interesting to this room is that in 2021, we had 110 billion views on health-related content on YouTube globally. In Germany, in my territory, that will be for last year 300,000, out of which a substantial part is interested in mental health content. So there's a vast interest in health information. And of course, that creates a few things that we need to touch upon. So what we want is, of course, we want the information to be accessible everywhere and free. And secondly, we want it to be credible. And thirdly, as you can see, we want it to be easy to understand, which seems natural, but is something that we probably can later also discuss with the people that are experts in creating this type of content. It's not so easy in real life because medical topics are complex by nature. And to break it down in a way that my mother can understand it easily is not so easy, because people that talk about it often are physicians and doctors and professors that have a language of their own, and that might not be the language of the patient that needs to hear it. So it's a complex situation, but it's also a very interesting opportunity seeing these numbers. So as Andy pointed out, YouTube Health was founded in YouTube about 3.5 years ago. And we did something that hasn't been done on platforms before, is we knew that we could not answer from an expert position, even though we have many doctors and medical experts in the company, but we needed a third-party evaluation. And the third-party evaluation came through reaching out to the National Academy of Medicine in the US and asking them to develop these criteria to identifying credible sources of health information, and then asking Andy and the WHO to step down on it and verify it for global use, because we didn't just want a local US-based criteria, but a globally useful criteria. And we asked this NHS in the UK, CMSS, to verify on this criteria. And then we used that criteria as kind of a architectural plan for product features. And what we did is we created 3 types of product features that when the user, the 110 billion views that you just heard about, looks for medical information, they usually, when you go to the platform, there's a few ways that you probably, when you use it yourself, try to get information that is interesting to you. So either you use for somebody that creates content, we call that a creator, that be the health ministry in Germany, or that be an individual doctor like Dr. Mike, that's a creator to us. So you probably know a creator that you like or trust. Maybe you live in Berlin, you like the Charité, like I do. I live right next door to it. You know, have been to the emergency room, so there's a certain level of relationship established. So when I look for information, I go and look for Charité and see if they have something on a health condition that I care about. But mostly when you use the platform, you probably start with a query. You start with a question that is on your mind. What's up with my diabetes type 2? Or how can I prevent it? Or what can I do with my high blood pressure or whatever? And then the platform would show you a selection of videos that you're familiar with. And that selection is a multi-factor process of what is recommended to you. And a lot of these factors, of course, when you look at entertainment content on the platform, a lot of factors that our popularity, engagement, they're good, but with medical information, popularity might not be always the best indicator or signal. Credibility is. So that's why we used the criteria that came from the NAM and the WHO, and we created, first of all, the source information panels that allow you to identify under each video of a creator. For instance, if you was to go to Charité, under each video you would see this indicator just right under the video in blue that shows you, oh, this is from an accredited hospital. And if you want to know what that means, then you can click on that, and it leads you right away to a help center that would show the paper of the NAM, it show the paper of the WHO, and give you all the relevant information as to why this hospital has this information, so that you can see from where you get your health information and what the credibility is. Secondly, if you search for the condition, of course, you probably find a video that looks interesting to you, and it might not be from the hospital, but might be something else. So that's why we created the health topic shelves. So if you was to give in, oral cancer, you get videos to oral cancer, and first what shows up is the health shelf, where it's indicated from health sources. Then the videos of those certified channels will predominantly be seen, and then other videos will come. Not all videos that are not certified in that way are bad health information, but you want to, as a user, you want to make the distinction. Like if you go to the pharmacy, there is a difference between a prescript and an over-the-counter. Both of them be beneficial to your health, but it's a different thing. So you want to know where's the difference. And then thirdly, a lot of relevant information that people look for is something that they can relate to. So it's patient stories. Somebody from their community probably having the same health problem that's more relatable than me looking at a video for somebody from Japan having a condition, lives in a totally different environment than myself. So these are the 3 products that came from the criteria that was given to us by NAM, WHO, etc. So as said, we're partnering up globally with many partners that you're familiar with. Many of those partners are on the ground here, may it be the Johns Hopkins Clinic, Mayo Clinic in the US, may it be the NHS, may it be Charité, And we have from NAM and WHO, we have the criteria that starts with the health ministries and the hospitals, universities, and goes down to the accredited or licensed doctor. So we have a variety of people that now you will find having that label that allows you to identify their content. And then also another thing that we're trying to do is we're trying to empower the medical community to do health content to raise health literacy. And what we often find is that the most authoritative medical voices are not often at the same time the most entertaining voices. I'm sorry. I'm not. So what we're trying to bring is we have different programs. At some points of the spectrum, we have people that are very good at creating content. So now with the criteria of the WHO, we can help them have more authoritative content. And then on the other side of the spectrum, we have very medical authoritative people that need to learn to do engaging content so that my mother can understand it. Or your mother. Or you. Or your children. So we're doing one big program there where you see also the WHS logo on top is we're doing a health accelerator program in 6 countries right now with the help of the WHS, where we allow any physician, any doctor to come in, any health professional to learn the trade of medical communication with authoritative content, but also in a way that people want to watch it and people can understand it. And then secondly, of course, for us, it's very important that what you probably know from some of your extracurricular interests, on YouTube you will find videos about anything, may it be so small that you think nobody cares for it than myself. And of course in health you have a lot of marginalized and underserved communities that have health issues that are not only medical issues, but also health issues related to where they're living, what their circumstances are. And a lot of these people, they have something to say, but I don't have the means to it. So we have another program created that allows us to support these groups with insights, with technology, with infrastructure, and sometimes even with some grants, so that they can do it and create health content for their community. With that said, I think I can gladly hand it over, because if there's somebody that knows about these communities in these situations, then it's the Honorable Eliza. So hopefully I can pass it over to you at this point.
Thank you very much. Speaking after Andy and Gertz, we already have most of the content, not only the content, but also the frame and then the platforms that we would like to use to reach not only the biggest number, but as we often say, so in the jargons, the hardest to reach, the most vulnerable. And we call it often also the last mile. Well, if it is true that the biggest problems are in the last mile, maybe to make global health truly global, we should make sure that the response should be the first mile. I think the response should be the first mile where we find the last miles of the problem. So you have heard, I think, because of COVID and many other challenges, that were global in nature. So we use a lot of our slogans. None of us is safe until we all are. How can we create platforms where we are getting more interconnected and then bringing us together, in a world that is, fragmented, etc., etc. But the true spirit of the World Health Summit was really to create, that platform. We will have, multiple stakeholders, to come together, to learn from each other, to challenge each other in many ways, but also to partner, moving forward. And I hope that by getting here, so you feel also that spirit which has animated us in putting together, this program, including, this session, of today. And I believe that the session is also in the same spirit. The world is fragmented, we say, but at the same time, we're only one click away from each other. If you want to meet, in person, the Director General of WHO, you will have to go through different hoops and different PAs and telephone numbers, to be connected to each other until you eventually meet him or not. But at the same time, anybody anywhere in the world, could, with a click, either reach him directly or say something that make him react, quickly. And I think that says, quite a lot. In now the tools we have, in our hands, and then the question is only how we're using it, and what do we put, inside of it. So, Gigi, you were just saying, half jokingly, that maybe the most credible sources are not, the funniest or the most exciting or to present it, because we see that. Often at times what we consider to be disinformation and fake news and so on, they speak to people and attract them at a certain level, because we do not always go there and then looking for this sophisticated, information. Often we go in there to maybe try to validate what we believe, or try to get a validation of what we think, or even to get an encouragement of our denial ourselves. Because the issues that we are dealing with, when we talk about health, and that will push us most of the time to go and look for information and solutions are not easy issues. It's often issues that we have difficulty facing a health professional or anybody even to disclose. Because if you ask a question, the simple fact that you're asking a question on a certain health matter, you are indirectly disclosing something about either your own health status or the health status of somebody who's close, to yourself. Because not everybody will just, wake up, every morning and then go and look for something on diabetes or on hypertension, or for something, that are some other issues that are more intimate, to each of us. And health issues, that touches on very intimate issues. My anxieties, my mental health issues, all the kind of demons, that also I'm struggling with, that are invisible wounds, that are also real health issues and real health problem. And that is the reason why it is just so important, that we get, the credible sources, because what we talk about, misinformation, fake news, and sometimes we take it so lightly. It's a matter of life and death, for many in the world. And we should not really take it lightly. That is something we should take extremely seriously. So we can achieve that, of course, only through partnership. We need, the science, and then we need the evidence, that will be the base, for it. And that will be informing the decisions, that will be also putting the right content, in the right places. You may think that, all information or all decisions are based on factor and science. It is not, the case. Very prominent people, that people look up to, it could be a credible vehicle, of good information, are often, part of the problem rather than the solution, because of the type of information they would like, to provide for reasons that have nothing to do with health, to start with. And I think that kind of a partnership that we now are really promoting through the World Health Summit together with WHO and yourself is pretty much in that line. Here, the summit is just a miniature, of that, where we all come together. And I hope, we get out of it, each of us a little bit richer in knowledge, richer in questioning, richer in doubts, and to open us, to be more humble, to learn and then continue to learn from each other, and then take more responsibility. And I cannot stress this, enough. What a heavy responsibility, it is, to work on a content, to put it on a platform, that the person which is thousands and thousands of miles away, can reach, and then sometimes it is the only source of information she or he has. And if that is wrong, what a great responsibility it is, on our shoulders. So I think I don't have any slides after you, but I just wanted to convey our motivation, by designing the program of the World Health Summit, but beyond the World Health Summit, the kind of partnerships that we would like, to continue to build and continue to do the work between Berlin and Berlin, because the work, doesn't stop, only the work after. My last point is that just one word, on the Kofi Annan, Foundation. Kofi Annan, recognized, very, very early, the importance, of involvement, of young people, and also in the importance of awareness, to work and then live in a digital world. And I think the legacy that is translating that, more concretely, is two movements of young people. One is the Kofi Annan change makers that I want to be part of this process as well, to influence as well as sensitize, their own peers by continuing to vehicle the right information on the different topics of health, but also on peace, non-violence, and reconciliation, all those things that we need so much and that are missing in our world today. The second one is the young people, they're called, Extremely Together, who are coming again, together against violent extremism, to try to put, a halt of all the ideologies, that are enticing young people to go into violent extremism, and then put it, in a more positive way, in Extremely Together for Peace and Non-Violence. And I think that is pretty much in the same line, and then we look forward to continuing those partnerships together with all of you. Thank you.
Thank you, Mr. Assi. So we've heard a lot from, let's say, the enablers of information and high quality health information. I think it's equally important to also hear from the creators of such information and such content. So next I want to welcome Catherine McCarthy from Medical Aid Films.
Great. Hello, everyone. Thank you very much for having me on this incredible platform. I feel very honoured to be here with these amazing people. So thank you. I run a very small organisation called Medical Aid Films, but I'm very used to working for a very large organisation, which is the BBC. So I worked at the BBC in education and broadcasting for many years. So editorial and production values of content is absolutely in my blood. So I want to talk today a little bit about the work that my organisation does in developing that high quality, trusted, accessible content, which is really, really available to very vulnerable audiences. So what do we do? So Medical Aid Films is a very unique organisation. It brings together health experts, health professionals with creatives to create content. And when I say that, I mean we create film and animation that is educational and that is life-saving. So it provides vital health information to disadvantaged communities and health workers globally. So we have 4 pillars to our work. The first, as everyone has talked about today and over the last 2 days, is partnership. We work with partners around the world to help us develop the content that meets the needs of target audiences. We're effectively a producer. So we produce a range of content from sometimes documentary, but short, factual pieces, sometimes longer form, sometimes short form, sometimes animation. Sometimes that content is shot all over the world. Sometimes it involves real stories, real people. And it's chopped up into lots of different lengths for use on platforms. We also are interested in innovation, and we use innovative technologies, not for the sake of it, but because we want to reach and engage our audiences. And finally, we create content, but we also want to know it makes a difference. Was it effective? Did it make a difference? How do we know it's made a difference? And how do we learn and understand how to make better content so it makes even more of a difference? What makes good quality, accessible, trustworthy, engaging content that really, really reaches people? So a little bit about our history. We were set up about 16 years ago by leading gynecologists and medics in the UK who were travelling to various countries and realised that their resource was just not enough. They couldn't meet the demand for basic information, life-saving knowledge and skills. So they had the inspiration that perhaps film could provide a long-term, sustainable resource that could be shown again and again in hospital waiting rooms, in health centres, in rural, remote parts of the world, and on mobile platforms. And since that early focus, which for us was very much focused around maternal and newborn child health, so we have a whole suite and range of content in that area, we've widened out, but women and girls are still a very, very central part of what we do. We've also done some girls' education work. We've done lots of mental health and well-being, NCDs. We responded to Ebola, Zika, and more recently, COVID-19. And our work with COVID-19 was for vulnerable communities in the UK in languages that they were able to access. We've also done a lot of work around adolescent sexual reproductive health, and I'll talk a little bit more about a particular project. So even though we're a very small organisation, we have a very big impact. We have a huge archive library now of over 700 health films that have been viewed in 140 countries. We have 10 million views online each year. And most importantly, our content is available in over 51 different languages. And as I said at the beginning, partnership is crucial, and we partner with over 65 different partners around the world. So I think we are trusted by the global medical health community, and we work with loads of organisations, many of whom are here from those major global NGOs. We work with WHO, we work with YouTube, plus we also work with medical schools. We work in country with lots of small organisations. And of course, that's hugely important for a small organisation, and partnership is critical for us. Just talking a little bit about the process, for us, what makes good quality content? It's not as simple as about going and holding a camera and editing it. We go through a very rigorous process from the starting point, which is the editorial brief, all the way through scripting to animatics, if it's animation, dissemination and research. But what's most important is that we have medical review throughout that process. So at key stages, in the script, in the animation, in the rough cuts, in the storyboard, we are showing that content to medical experts who are the experts in that field. And not only that, we're also showing it to our audience. We're saying to our audience, that's script stage. Is this right? Does it make a difference? Do you understand it? And at picture stage, we're saying, are these the right pictures? Does the setting look right? Is the colour right? Is that the right kind of clothes? So every stage through is tested and reviewed. And that's because we want to make content that really does make a difference. How do we know it works? Well, we do a lot of work around, obviously, user testing, understanding our audience, understanding audience needs, designing the relevant content to meet that need, testing it, looking at the data, the analytics, testing with pre- and post-knowledge surveys, and other more sophisticated research techniques. And we build the body of evidence around the content because it has to work. And we have to know it's correct. Life-saving information has to be correct. Here's a little bit of information. We did an annual survey, and I love giving this figure because 100% of the people responded saying that they thought our films were excellent and good in terms of being informative and useful, and that's a pretty good result. When we also did other testing on our films related to newborn and child health, you can see the difference in just one viewing of the film, that mothers were able to recognise the 5 danger signs in illness in a newborn by just watching our film once. And that jumped from 4% to nearly 50%. So we know our work makes a difference. We test it, and we know it does. We know that our films have increased engagement from men. Even though those films have been focused on women's health, we know that men have been engaged by them and have wanted to become more involved as a result. We also know that 17%, there's been an increase of 17% in mothers attending medical checkups 8 weeks after birth from watching our films. So we know that it makes a difference. So we know that change can be achieved. So just a few final words about, we have one project in Zambia, which is called the Screen Project. And that's where we've worked with young adolescents in Zambia to co-create content. And they've worked with us all the way through that process. And this is a project, a health communications project aimed at young people in the most remote and rural places in Zambia. So what was it? It was a series of 6 films that have been co-designed, co-created, co-developed, co-shot by young people in Zambia. And the people you can see on screen are actually also the stars of the films. So not only did they help us develop them, they're in them, they starred in them. And most importantly, those films are in English, but also 3 other languages for Zambia. And we work closely with the Ministry of Health. And what did the Ministry of Health say they most liked about those films? That they were authentic, that they used real people. They didn't use actors. They made the films felt really genuine. The films felt like they were relevant to the audience and tailored for them. And finally, this was a project we did using film in Zambia to do with engaging men in women's health. And I always like this quote, the films have changed things in the community, and we want this to continue. So finally, recent developments. We've also been working with YouTube Health in the UK, and we've been involved in a lot of that development. We love working with them, and our content has the tick and is now on the health shelf. So we've seen our views go up because of that. So that's been amazing. We've also worked with a group called the Kubrick Group in a data partnership to enable us to become more data-driven as an organisation. And finally, use of AI. We've been super excited by this project. Again, we've been working with YouTube on this in a project called the Allowed Project. And this allows us not only to translate, record, and dub our content into different languages. So first of all, the project is working in Spanish, and then Portuguese, and then I think Hindi is coming, and many other languages. So for us, this is a total game changer, that we can translate, voice record, and dub content overnight into new languages at no cost. Of course, you have to check it. And luckily, I've had a Spanish speaker on my team who's been able to verify the translation and the voicing. But again, an amazing, amazing project, which we look forward to being in. So finally, a few things for our future development. And obviously, I'd love to talk to anyone here. We're keen to build our work around maternal and child health and women's health through their lives. We're interested in developing packages of multimedia content and reaching primary health centres. Collaborations are key to us, so come and talk to me. And finally, I haven't shown you any of our content, but I am going to encourage you to go to our website and take a look at some of the films we've got. And of course, contact me as well. Thank you.
Thank you, Catherine. Next up is Dr. Julia Fischer from ARD Gesund. Thank you very much.
Okay, perfect. Thank you. Thank you very much, Lynn. Hi, everybody. Nice to see you. Thanks for having me. I'm very thrilled to be here. And yes, I'm the host of ARD Gesund, which means ARD Health. And in order to explain what we're doing, I think I'll start out by explaining what the ARD is, as it's a pretty special German thing, I think. So the ARD is one of the two big public broadcasters that we have in Germany, and it is actually a public broadcaster association that is divided or consists of 9 state broadcasters. So in Germany, not every federal state has their own broadcasting station, but Germany is divided into 9 regions or organized in 9 regions, and every one of those regions has an own broadcaster that is bound or headed by the ARD. So the ARD is organized, it provides national and international information for everybody, but then also provides local and regional information just pretty much in front of the door where everybody lives in those regions. It's financed by contributions from German citizens, so publicly financed, and with that has to be totally independent of any influence, especially has to be free from political influence, and it has to fulfill the official public service mission, which is to convey information, education, and entertainment to the public. And with ARD Gesund, with ARD Health, we belong to the section of information and education. We provide health education, and we want to enable people to make informed decisions, meaning we don't want to tell people, this is healthy, this is not healthy, you have to do this, do not do that. But we want to give them the information that enables them to find the right decision for their individual situation and their individual health state. We deliver fact-based and scientifically sound information, and our information is accessible and understandable for everyone. And as the team ARD Gesund, we said we know learning is easiest if it's also entertaining, and that is why we try to be funny wherever we can. Now, what's the history of ARD Gesund? It was launched on YouTube in October 2020 during the COVID-19 crisis because, well, it was started by the NDR, which is the broadcasting station in the northern Germany, because they saw people really needed guidance concerning their health information. And they saw people liked them providing the information online because the channel grew pretty rapidly. And with that grew the idea of making it a bigger project and getting everybody ARD-wide, so Germany-wide, to get everybody into the boat and to introduce the information from all broadcasters ARD-wide, Germany-wide, into that YouTube channel. So we had a big relaunch in May 2023. When we did that, we were introduced all the content that was being created by the different broadcasting stations, and they found a new host, which was me. And in June 2023, we were awarded with the YouTube's Health label as the first YouTube channel produced by a public broadcasting station worldwide. Now, our mission, as we are a public broadcasting, we enjoy a high level of trust, but with high trust comes high responsibility. Everybody pays for our information, for the content we create, so we really have to be accessible to everyone. We have to be free, and we have to broadcast our information as wide as possible. So using every platform that we can, and to that obviously belongs YouTube, because we know many people, actually I think most people get their information, also their information on health online, which is why we have to be there to pick them up and being able to answer to their questions. And ARD ensures that only reliable information reaches the user. Our main target group are people between 30 and 50 years. Although, of course, everybody is invited, and we also have younger and older followers. Our topics are mainly pretty much on the prevention side, so nutrition, exercise, medicine, by which I mean we talk about the common illnesses in that age group, how to diagnose them, how to treat them, how to prevent them, and we also cover topics of mental health. And we have different content, so there's a series that I present. Every Thursday we publish a video where I explain one certain health topic. Then we have the nutrition docs, a team of physicians who treat their patients by changing their diet. And then we have the health videos from all the other, from all the broadcasting stations in Germany. And every piece that is uploaded to the YouTube channel is reviewed by experienced medical journalists and licensed doctors. So we really have a multi-stage fact check to make sure that really only reliable information comes online. The main challenges are, Gigi mentioned that earlier, that of course one big part of work is the whole research, and then the real balancing act is finding the mixture of conveying the correct information, but doing it in an easy way and doing it in an understandable language, to find the right balance between scientific and colloquial language without falsifying information or without omitting important information. We also want to stay up to date as new facts emerge scientifically, but also up to date with the public discussion. We want to stay up to date with social media trends, so we can also do myth busting as soon as some fake news arise or whatever. And we're really interested in, we really want to interact with our community. So we want to know, do they like our videos? What do they like about them? What can we do better? Are there remaining questions open? What do they want to know about their health, so that we can really develop into becoming more and more what they like. Yeah, so we try to make solid information available where the people are, which is online and on YouTube. And we want to catch them in their everyday life. So we really want to answer the questions they have in their everyday life. For example, if there is a woman who has menstrual pain and she's asking herself, okay, this pain really is bad. How bad is normal? When is it pathological? How can I find out when it starts to be pathological, and what could be a reason? Or when the WHO declares scientific sweeteners as possibly carcinogenic, what does that mean for me and my love of Coke Light, for example? So we really want to answer the questions that the people have in their everyday life. And as I said, we try to be funny wherever we can. Medicine isn't especially a topic. It's not always possible, but whenever we can, we want to really also make sure that the audience can laugh. And maybe I will end my presentation by showing just 1 minute of one of our videos, so you can kind of get a feeling of how we do it. One thing that we really like to do is that I interact little scenes where I play Julia, but I also play her liver or her menstrual cycle entering the room, being there too early, and then having quarrels between Julia and her menstrual cycle. That's how this video ends, and it's kind of cut off in the middle, but you'll get a feeling. Thank you.
Bist du kurz vor deiner Periode so richtig mies drauf und findest einfach alles scheiße? Hast du während deiner Tage Schmerzen, die sich anfühlen, als würde eine Faust deinen Unterleib zerquetschen? Vielleicht bekommst du auch einfach jeden Monat Pickel und fühlst dich so richtig aufgedunsen. Oh nee. Oder tut dir der Eisprung weh? Ja, der weibliche Zyklus kann ein richtig verdammt verficktes Loch sein. Und noch schlimmer ist sein Ruf. Aber er hat tatsächlich auch positive Seiten. In diesem Video erklären wir dir, warum du rund um deinen Eisprung zu Hochtouren aufläufst, an welchen Tagen im Zyklus du Gehaltsverhandlungen mit deiner Chefin führen solltest und welche Phase sich perfekt für den Aufbau von starken Muckis eignet. Ich bin Dr. Julia Fischer und gemeinsam gucken wir jetzt, wie wir das Beste aus unserem Zyklus herausholen können.
Hallöchen!
Cool.
That is absolutely wonderful. I want to watch more of this. Okay, well, thanks to all of you for these wonderful insights and these incredibly interesting conversations that we're about to have. So I think we've unpacked so much in the world of health information. We've heard about programs enabling healthcare professionals to create content. We've heard about programs making sure that users and viewers can actually identify what is a credible source of information. We've heard about creators of health information themselves. So there's a lot to unpack. And so we're going to go now to a Q&A session. And at the end, I'm going to open it up to all of you in case you have any questions to our wonderful panelists here, okay? One, two, yes, here we go. Okay, so the first thing that I'd like to start with is this notion of collaborations between the different, so the public sector and the private sector. So the WHO and YouTube have done a lot of work together, which we've heard from Gigi and from Andy today. I think I want to direct this question to you, Gigi. there's this joint work of defining what a credible source of information is. This seems particularly important, especially when it comes to the notion of the fight against misinformation, which we're collectively in. And so can you give us a perspective on what you think all the different orgs need to be doing collectively to work on this? And what does it mean to elevate information, but also to fight misinformation?
Can you hear me? Yes. I think we look at it. What I presented first was we needed to look at the real experts to help us define what are the criteria and indicators to identify it so that we can label it. But secondly, of course, that's the positive side. We find the good hospitals, we label them, they produce proper content. Julia produces proper content. I'm a follower from now. And but there's also, from the pandemic, we all know there's also has been a lot of medical misinformation out on everywhere, and also, of course, on our platform, because it's an open platform. Everybody can upload videos 24/7, and it's to strike that balance. So when you look, when you take an example in the garden, we need to weed the weeds, but we also need to plant the seeds. So we need to get rid of the bad stuff, but also groom and help the good stuff come up. So it's a two-way work that we do. So, for instance, on YouTube, there's a couple of layers of how we get rid of bad content or harmful content, which is, of course, based on the local law, children protection, our platform rules, and then when it comes to YouTube Health, also the criteria that is based around it. And then in YouTube, we use a system that we call the 4 Rs, that we apply to every content, but of course, especially also to health content, which is remove harmful content, reduce content that is borderline, it's not already harmful, but we don't want to push it, then reward the good content, and then raise the content that is very helpful. So into raising the content goes a lot of signals that our system can understand to raise it. And at the same time, our departments that work to reduce the harmful content, we use our internal human checks. We use, of course, algorithmics and AI checks on the platform. But then we also use trusted flaggers, organizations that we ask to support us to keep the platform clean. And then fourth, every user can be a flagger, because when you go and watch a video about health, and you think it's very non-authoritative or you think it's harmful, on each video you see a little flag logo that you can press, and you can report a video where you as a medical doctor or you as a health professional can understand this video is really harmful. You can flag it to us. So our systems have 4 or 5 ways that harmful content will be identified and can be removed. And we get better and better because we also learn more and more, and our systems and our teams get stronger internal as external. So in evaluating the good content providers, we have external help, but also in evaluating the bad content and removing it. So it's always an inside and outside work that creates the most safe possible environment, and we're learning every day. Of course, it's not yet perfect, but we're improving it every day.
And this, I guess, Andy, this is this notion of raising high-quality content. This is at the heart of the FIDES program that you've developed at the WHO. I think one notion that was really interesting in your presentation, I think you mentioned that you want to measure success not only by views or impressions, but also by behavior change. Can you talk to us a bit more about this? This notion of, we start with information, but then we want to see the results in real life.
Yeah, definitely. And I'll use my poor friend David in London. He gets this in every presentation I make, but he's a perfect example of what you're talking about, Lynn. It doesn't matter how many people see or how often people know that something is harmful. David is a smoker. He knows all the time that smoking is bad for him. His health is not going to improve because he understands the message. His health is going to improve when he stops smoking. So David stopped smoking. From that point of view, that's what we're really interested in. We're really looking into working with academia and YouTube and other platforms to see how we can measure that behavior change. Are there ways that we can do, let's call it a digital health intervention, where we would have multiple cohorts of people. One, we would survey them all before the messaging. Cohort 1 would get no messaging at all. Cohort 2 would get message A. Cohort 3 would get message B. And we would be able to see on the data by subsequent another survey, an interview about finding out what if they've done something or changed their habits, whether these messages have an impact. And I think that's what we're all trying to do here. It's not about reach. It's not about impressions. It is about changing behaviors and advancing public health. So I think the only way we can do that is through partnerships. And to your point, Gigi, the raising of good content is so vital because misinformation thrives in a vacuum. And we really have to tackle that issue and get the good messaging out. On the other hand, it's a hard job to do because misinformation can be created in 3 minutes with a mobile phone. Science takes time, and getting the message right and accurate is difficult and complicated. I love the work that you just showed us there, Julia. It was excellent. The use of human traits. The WHO is not known for its sense of humor, but our FIDES members are. And they can use all the human traits to get across messaging, which is much more understandable, much more interesting, much more engaging, I believe, than just an organization saying this is the science, please follow the science. They can use humor, anger, wit, frustration. And I find that so beautiful about independent creators.
Yeah, absolutely. And actually that relates to, Catherine, what you were showing us earlier. You had really impressive numbers on how your videos have reached certain communities and the difference that this has made. Can you talk to us a bit about how you actually you achieve that through your content? Is there any specific technique that you use? Like, how do you break down the language barrier and the cultural barrier to reach all of these different communities?
Yeah, thanks. Well, kind of relating a bit back to what I said, we work really hard at trying to understand who the audience is and to try and make the content as relevant and tailored as we can. Obviously, having content in the language someone understands is absolutely crucial. We work quite a lot on story-driven content, so our content will take you, it's not just kind of conveying lots of factual information, it takes you on a story. It shows you, you'll see people who inspire you, people who you relate to. You'll see settings that you find relatable as well. We work extremely hard on scripting and going back to the collaboration, it's a creative collaboration, bringing together creatives with experts to work on a script. We use plain language, we break down terms, and if we can't break down a term because a medical expert won't let us, we explain that. We explain the term. So we work really hard on, how long is the format? What's the right length? What will people be interested in seeing? What will engage? And then we measure that to make sure we test it. So we go back and we say to the audience, did that work? Did that look right? Did that reach you? Do you remember it? And we want to make sure that people did remember it. They did learn something and they did do something. So that's the journey is long from the audience, beginning with the audience and coming back to them, really, and involving them all the way through.
Yeah, that's very impressive that you managed to do that, actually. It's really hard to reach these communities sometimes, and when you manage, it's extremely satisfying, so well done on that. So that brings me to the next question, specifically around health equity that we mentioned at the beginning of this panel. And maybe I'll ask this question to you, Mr. Assi. So I think you're obviously, Julia, Catherine, you're in the business of creating content to reach populations and increase their health literacy, right? Now, a strong example that comes to mind would be maybe countries in Africa, or Africa as a continent has one of the highest uses of the Android platform, but very limited access to broadband. So when we talk about access to information, this is an issue. This is specifically in comparison to more mature markets, of course. So when we turn our attention to online information and video content, what do you think are the most effective ways to address those social determinants of health, such as poverty, housing, education, but also infrastructure and access to internet and information in general? How can we ensure that all of these people can access this wonderful content that these people are creating?
Yeah, I think that brings us back, to partnership and collaboration and complementarity of the different actors and stakeholders. So you mentioned infrastructure, which is extremely important, and that is the, role of government, in many countries, but also the role of the private sector to invest, together with government, in those infrastructure. But I think we could not underestimate also the role of government in creating the space, the safe space, for that will enable, those investment and the use of those infrastructure, to happen. So it is also about having a whole chain of consistency in what we communicate and how we communicate it. Because as I was alluding to, and you said it, and the behavior change, is very difficult, and it is not something linear. So, smoking is a very good example. I think you talk about your friend in London, but my friend Paul will say, stop smoking is very easy. I did it 10 times. So, because then, people try to change behaviors, and then they fall back, and they retry again. And I think the consistency, in the content, of the message, and also the different ways through which, it is communicated, and who's communicating it, all of that is extremely important. And I think that is also very valid in the, African continent and all, other continent as well. So people will go and then if they have any hesitation, they got the facts, they got the science, smoking is not good, and then you have to change your behavior and so on. You get a fake news, that makes you feel comfortable in your smoking thing, just, again, make you think twice. And particularly if it's coming, from certain sources. So I used to work on HIV many years ago, in the days when there were no ARVs, there was nothing. And there were Nobel Prize winners who were saying that HIV doesn't cause AIDS. So, and people who were having difficulty, with talking about sex and, dealing with issues of changing your sexual behaviors and using condom and all of that. And then here you have a Nobel Prize winner would say, okay, this is all bullshit, it doesn't cause AIDS. So you're then comfortable in not changing, the difficult, behaviors, that you are having. So to come back now to the equity, part, as we were saying, connectivity is important, access is important, infrastructure is important. When we all have all of that, the content, should be consistent, in terms of the evidence where it is based, and also the credibility of the source. And the credibility of the source, as a kind of a validated scientific source, but also the credibility of the messenger, that is extremely important. And I think it is not by chance that you're having your actors, in Zambia coming from the community, themselves to give credibility in the message. And that is you yourself, Julia, talking to, to the German, public and, using very tough words. I think, that, that, you cannot use Scheiße in WHO. That's what, and that is, I think, all very important. Okay.
Thank you so much, Dr. Assi. I think that touches on the notion of, ensuring that there's global access, global equity, but there's also equity at the national level, right? And Dr. Julia talked about this earlier. So I think, obviously, ARD Gesund with Julia Fischer, that's one show of many shows that ARD produces, mainly for on national TV. And then you took that and that's also now available on platforms such as YouTube. So I think that's the notion. I think you talked about meeting people where they are, right? So, you know, with that, is there anything that you think is different between the audience that watches you on TV and the audiences that watch you online? Do you speak to them in different languages? Do you use different tones? Do you use different formats? How do you view that in order to make sure that you're reaching every single citizen in Germany and they're all listening to that message that you're trying to spread?
ARD Gesund by itself is not a TV show. That is really a project that we started online only, but it combines the video content that was produced for the different TV health shows we have in the different regions. And I'm a presenter for one of those regional health shows. So yes, if we talk to our the viewers that watch us on TV, there is a totally different language, a totally different dynamic. We tell stories in a different way than we do it online. Because one thing that's happening, I think, probably worldwide, but on German television, is that we have difficulties engaging the younger people. So we really try to be modern and dynamic and also addressing the younger people, but we know they're more like on YouTube and on the internet. And when we try to make ARD Gesund, we totally change the tone. We are much faster. We all know how important the first 30 seconds on a YouTube video are. So we really have to get to the point within, like, as fast as we can, actually. So we want to engage the people where they are in their everyday life. We want to grab them with something that feels familiar, that they've been asking themselves or that they felt before, maybe, and then within a few sentences tell them right away, this video is about, and we'll answer this question for you. This is what you'll learn. And then, it's a faster way of telling a story. It's probably... Yes, maybe a little bit more funny. We try to find allocations from social media content, so we use GIFs or whatever. So the language is different, and that's where we put a lot of effort, trying to really be creative, to really address the younger people who are online.
Yeah, makes total sense. Thank you. So, okay, I think I have more questions on the equity front, actually. But I want to make sure that we have time for questions from you guys. So maybe I'll ask one last question to this group and you can let me know who wants to answer. It's a very general question, specifically on artificial intelligence, because it's very hard to talk about health information in this day and age without talking about AI. So, you know, in one of the panels yesterday, it was mentioned that AI will potentially change human interactions. In the tech world, we see it as the biggest inflection point since the smartphone. And so it will definitely impact how we conduct public health functions, right? So, you know, how do you think AI will, specifically generative AI, since we're talking about the world of information, how do you think this will affect the dissemination of health information? And what does that change for you guys in how you conduct your operations? Anyone wants to have a go? Very early days, but
I have an opinion about everything, so I'm happy to take that. I think I'm a fairly positive person about this. I think it's going to end up in a good place. But there are obviously, it's a double-edged sword. You can equally create misinformation very quickly with AI. I do think that there is a huge opportunity for public health to really, and especially public health creators, to use AI to sift through all the noise with targeted requests that will allow them to create content faster and more efficient and based on more accurate information. We have to just work to make sure that it is the AI that is being used is accessing credible sources of information and not the internet at large, where everybody's opinion seems to be equal. And I think that's the key thing for us, is that when we look at this, we see it as a very positive thing that will maybe help us cut through some of the scientific process and get to the end result faster. And as I said earlier, misinformation will be created 3 minutes on a phone. Hopefully AI will help us with the science-based messages to be 3 minutes on a phone. Who knows?
Catherine, you also mentioned something wonderful with AI, which allows you to produce your videos at scale in various different languages. So that's also a positive story on your end, isn't it?
Yeah, no, absolutely. I mean, it's just a massive game changer for us, and we're super excited about it. And it enables us to create content in multiple languages at no cost and very, very efficiently and quickly. So that means that we can make our content more accessible to more people, which is ultimately what we want to do. So for us, it's fantastic, but it wouldn't have been possible without YouTube's Allowed project. So, we look forward to that going into many more languages so that we can continue.
But you can come and talk to us after this, and we can tell you about our secrets on that.
When it comes to AI, I think it's also in the very general notion, when I, let's say, look into the medical world for comparison, we all know that when we have a drug for a medical treatment that has a strong intended, it's a very strong drug, we also know that aside the intended effect, there's also always the side effect. So if you get something that is, like if you get penicillin, you can do a lot of very good things with it, but then, of course, it also has side effects that you have to take into consideration. And AI is probably one of the most powerful things coming our way to be helpful, but then at the same time, it has its own side effects, and it's a very young thing. So we have to watch the good with the bad and the bad with the good to utilize it in the right way. And I think what Annie said, or building up to it, now we're trying to, just from a medical AI perspective and large language, we're trying to create AIs that learn only from medical authoritative content, and we see what kind of AI comes out of that. So we limit the sources of where that AI learns from. So we're trying things, maybe I've heard of Palm 2, that's our medical AI that just passed a physician's test in the US with a pretty proper score. So in a good way, if you have the right teacher for the AR, which is the proper content, the population health content by the science institutions, by the government, intergovernmental institutions, if we feed the AI the right stuff, good stuff could come out. So I think it's to which school you're sending your kid is how you get your kid back. So we have to just, be good parents with the AI, because it's a kid, it's a super smart kid, that's the problem. So the kid is smarter than the parents, but we have to just make the right choices, which school, which books, then I think something good can come from it, even though that's a bit of a, not so technical way of looking at it.
Okay, thank you, everybody. I think I want to open it up to the crowd if you guys have any questions. Ooh, many. I think we have someone here with a mic, so maybe we can start over here. Yeah, thank you.
Okay. Hi, my name is Maeve Cook-Deegan from the German Alliance for Global Health Research. We're based at Charité, so the medical or the emergency room there. When we're talking about impact, when we're talking about access to health, there's been positive example after another today, so it's been really a pleasure to be here. My question is less about misinformation, but more about what happens when you have approved or created content which is no longer representing the full picture. So do you do an active, I guess, how do you approach that? I imagine there's different approaches from your different perspectives. Thanks very much.
I could answer from a very practical point from some of our partners. So when you look at the medical evidence, I'm an avid Cochrane report reader. You have certain cycles that are deemed to be used, like considered professional, to reassess the information to see if it's up to standards. So maybe 2-3 years. So we have partners like the NHS that create health content videos on health conditions. And then after 2 years, they revisit that same very content and update based on Cochrane and other sources that we all look at for evidence. In Germany, for instance, we have something comparable. It's Stiftung Gesundheitswissen. So they do animation videos, which allows them to revisit the video and can change it without changing the main actor. You know, if we go Indiana Jones and then 5 years later we want to change Harrison Ford, it looks a little bit different. So you get the point. Yeah, so if you want to be very like by the book evidence based, you could do that and revisit the videos. A lot of our partners already do that. Other than that is you take into consideration which type of health content you are doing, and if you, let's say, do condition-based content, a diabetes will be a diabetes for a very long time. What changes is often the component of treatment and the emergence of new ways of treating it. So you could create videos where you say, this is a diabetes, and then I do another video, which is, this is the current state of art of how to treat it. Then you probably would only have to change the treatment part of it, but not the diagnosis of it.
Thank you, Gigi. I think we have a question in the back. Go ahead.
Hello. My name is Aras. I am a TV show host. I have a health TV show in Kurdish, in the most popular Kurdish TV worldwide. So we have about 5 million viewers on average per week. But we are 6 million people. The population is 6 million people, but we have 5 million viewers. It's not because 5 over 6 are watching us, no, but because we are about 50 million people living in the world. So it's divided between Iraq, Turkey, Syria, and Iran. In Germany, we have 1.5 million Kurdish people living here, and they speak Kurdish. In different Europe countries, we have many Kurdish living in the United States. So I just checked my social media, my Facebook, for my followers from Germany are third. So Iraq comes first, Kurdistan region of Iraq, then UK, then Germany. The point is, all platforms that we are talking about, most of them, not WHO one, are belonging to countries, okay? For example, Dr. Julia is speaking in German language, so Germany people will understand. But Kurdish people, for example, we have about 50 million people. We don't have a country, okay? We are divided between countries. So I think we have to have a solution for the nations without countries. So if we have the same platforms in Kurdish, I think we can reach more than 40 million people that are living in this world. And because we say that we have one health space, and especially when we talk about pandemics, we have to educate them. My father and my mother don't speak any languages other than Kurdish, and they are human beings. They have to have the health education, the enough health education to protect themselves from diseases. So what do you think? What can we do to have something in Kurdish that we can reach all of this population around the world? I think this was, for me, the most interesting session I ever attended in last 7 years of my participation in WHS. Thank you very much.
That's amazing.
Thank you.
Thank you. That's obviously wonderful to hear for the panelists, and thank you for your question, which is extremely relevant to this. I don't know, Andy, if you want to take a take at that, because you were talking to me about that earlier, weren't you?
Yeah.
But, yeah.
I mean, certainly once I finished blushing from all the flowers that you gave us. And I've studied the Kurdish peoples, actually, as part of in my youth, and so hats off to the work that you're doing. It's a very tricky situation that you're dealing with here. I think the key thing is to figure out who is the influencer in this space, and it's not going to be a white European male telling Kurdish populations what's best for them. I think we have to empower Kurdish influencers and Kurdish physicians, Kurdish doctors and nurses to speak out. One of the things that we do in FIDES, and I'm not saying this is the solution, FIDES, it's one, I think it's going to have a multilateral, multi-platform approach to this, is to think about people's secondary audience. They have, if you travel in some countries, let's say you go to North America and you meet somebody and you say, where are you from? I've never met an American who says I'm American. They say I'm Irish, or they say I'm Italian, or they say I'm from Puerto Rico. And what we found is that everyone has a second cultural attachment in the world. what would be very interesting in the situation, especially to you, but also other vulnerable populations around the world, is to think, how do we use the people who have already massive influence and find out what their secondary attachment is and ask them to produce content for these vulnerable populations. I'll give you an example. We're working very closely with YouTube in Brazil. They provided us with 100 and 120 creators. When we're thinking about what we can do in the Portuguese language, we're not just thinking about Brazil. We're thinking about how is the messaging that they can give relevant to Angolan populations, where there are no real influencers, where there are no large Dr. Mikes of the world that are going around having millions of followers. So I think it's a very digital space allows us to use this cross-country, cross-topic, cross-language ability to reach people. So I think that the real thing is empowering the individual and helping that digital literacy. And to think very carefully about who you're trying to reach and where they are. Because if you're trying to reach young people and you're using one platform and they're not there, then there's no point. You really have to start at the source. What message are you trying to tell and what populations? You're not going to have a blanket, one message is going to deal with all of your community. As you said, it's going to be different health topics. So I think that's really, for me, is the answer, is to find where we have developed creators who can support vulnerable communities around the world from where they are, from their own living room. They don't have to travel. But I think that's a really interesting approach to it. It's not the only solution, I don't think.
Yep, we're going to have to continue working on that, won't we? But anyway, I'm getting a signal that this is the end of our session, unfortunately. But we're going to hang around for a bit, if we can. So if you want to come up to us and ask more questions, we'll be happy to talk to you all. So I just want to end this session by saying we've talked a lot about, the concept of raising high quality health information online specifically, and the trickiness of dealing with removing, detecting and eliminating health misinformation. I think you've seen from this panel that we've done a lot of progress in that space, but there's still a lot to do, especially in the aspect of equitable access to this information. So we really look forward to continuing these types of discussion with you all and with different types of organizations as well. So thank you so much for engaging with us on this topic, and see you in a bit, hopefully.